what I think as a clinician, when someone says patient-centered healthcare, we just automatically think, well, of course, healthcare is patient-centered. So, just as a bit of a definition to help us out, can you just describe, in your opinion, what is patient-centered healthcare?
So, when we say patient-centered healthcare, it's all about working on your policies, on your processes around that patient, how that patient can feel secure, safe, and how we can enhance their patient experience. So the whole continuum of care goes very well around that patient. So that's what we call patient-centered care. So our processes, our policies, our experiences should have a focus. This is the patient, and everything revolves around them. The rest are enablers, basically.
Welcome everyone to the Bedsides and Boardroom podcast, where we speak about the intersection between business and medicine. Today we have Dr. Fahan on the episode, and we're going to be speaking about workplace culture. We're going to be speaking about leadership in healthcare, and then we're going to touch a bit on the future of healthcare and how we balance profitability with clinical medicine. So, Dr. Fahan, thank you very much for joining. It's great to have you on.
Thank you very much. Very good afternoon, Nathan. Thank you very much for having me here. It's really a pleasure having myself with you on this podcast. I believe we're gonna touch upon very important points that you have just mentioned, and I will try to learn as well as let the people understand how it looks like in the healthcare.
I mean, I was just mentioning now in our chat before that I was looking through your LinkedIn profile, and it's you've headed up quite a few organizations, been in some, I would say, extremely important roles within organizations, heading organizations, heading up HR, that kind of stuff. So, just for the listeners, can you please just give us a background on yourself and how you got to this point?
Sure. My career has been built around on a very simple belief, actually. It's about exceptional patient care, begins with exceptional people and well-designed systems. Throughout my journey in private healthcare, I have had the opportunity to lead operational excellence, patient safety, quality improvement, and human capital initiatives across different healthcare settings. Today, as a group director and of operations and human capital, I have the privilege of looking at healthcare through two equally important lenses, I would say. One is operational, which we're ensuring that the hospitals or the clinics that deliver safe, efficient, and high quality care. The other one is about the people focused lens, creating an environment where the employees, the clinicians, and the leaders, they can thrive. I have come to realize that operational excellence as well as employee engagement, they are not separate priorities. They are deeply interconnected. Um, Organizational growth, if you want to make it sustainable, it happens when people understand the organization's purpose, feel empowered to contribute, and they have the right systems and leadership to support them. So ultimately, my role is about aligning the strategy, the operations, and people so that every decision contributes to better outcomes for our patients, our workforce, and the communities we serve.
I mean, I love that idea of aligning people, leadership, and obviously what's happening on the ground clinically together to ensure that patients are treated to the best of the organization's ability. What I think as a clinician, when someone says patient-centered healthcare, we just automatically think, well, of course, healthcare is patient-centered. Um, it is about treating patients, they get better, and then they leave the healthcare system, hopefully better than when they came in. But it's not always the case that the focus of healthcare organizations is exactly on patients. So just as a bit of a definition to help us out, can you just describe, in your opinion, what is patient-centered healthcare?
So, when we say patient-centered healthcare, it's all about working on your policies, on your processes around that patient, how that patient can feel secure, safe, and how we can enhance their patient experience. So the whole continuum of care goes very well around that patient. So that's what we call patient-centered care. Uh, it is healthcare is fundamentally a human profession. If we become too focused on processes alone, we risk losing the very reason of those processes that exist. That is to improve the lives of our patients. So our processes, our policies, our experiences should center, it should have a center, it should have a focus. This is which is the patient, and everything revolves around them. The rest are enablers, basically. So the patient-centered care, uh, any system that we are developing, any process we are developing, we have to develop around a patient, keeping the patient in the mind and develop those systems.
I think that's a great definition, because it gives us a sense that there's multiple things or multiple parts of the healthcare system, and you mentioned the continuum of care that comes into allowing a patient to enter the healthcare system, get treated, and then exit. And as I said, hopefully better than when they came into the system. I love this idea of a continuum of care because unfortunately, maybe unfortunately in medicine, we go and we study a very thin part of medicine, a very small part of medicine, and we become really specialized in that area. Whereas uh, actually, healthcare has got multiple factors or multiple things that specialities that go into treating patients. So, how do we maintain this patient-centered approach without becoming overly process-driven?
So the good thing is that there are standards, there are accreditations, there are metrics. So you don't have to reinvent the wheel, honestly speaking. Standardization is essential because it creates consistencies and reduces the variation and improves the patient safety. Accreditation challenges us to continuously raise the bar, while performance metrics help us measure progress and identify opportunities for improvement. So fundamentally, what we see that these standards are used as enabler rather than constraints. Processes should simplify work for our clinicians, not create unnecessary administrative burdens. They should support the compassionate care and not replace it. So we also need to measure what truly matters. Alongside operational indicators, organizations should pay equal attention to patient experience, employee engagement, and organizational culture becomes really, really a critical factor in doing anything at the organization, at the healthcare organization. So these are the leading indicators of your long-term success.
I'm trying to work out more practically how this would happen, or maybe how you approach this in terms of you may have an organization that you're running has an issue. Maybe you can give us an example of an issue that has sprung up in some of the organizations that you've managed. How did you go about, first of all, finding that there's an issue and then addressing that issue?
So are you looking at a real life example of some patient scenario or some cultural scenario? Like what you're looking for?
Let's go both. Let's go both. Well, if we had an issue with the patient, how would we, how would you, how in your organization, how do you sort that out? And then maybe we'll go to a more systemic uh, problem later.
Sure. So if we if I just give you a simple example that we we have the patients in UAE who are very knowledgeable, and they are looking at the things in a very holistic manner, and they know what they're going through, and they're very cautious about their health, which is very good. And once they come to the hospital, they expect a lot in terms, because they already know the basics or the fundamental things are about that disease or that problem or that issue, and they expect that what they're gonna get from that visit to the hospital, and their expectations are really at a different level here in UAE, I must say. So when the doctor is telling them about certain screening, for example, a preventive, uh, you know, healthcare phenomena, they really get cautious about it, and they really want to get deeper into that part, and they do figure out that what they should be doing to manage that issue, which can prevent them from further disease or further aggravation of the disease. So one of the examples is when, for example, there are females coming to the obstetrics department when they get cautious about their screenings for different kind of oncology diseases. They just get very cautious, and they just want to get the things done very quickly, worked out for them for the screening part. Now, this is a kind of a preventive part, but once they come to know or once they get aware about it, they just want to get it done like this. So their expectations rise really very swiftly to the next level. And they need to get their MRI done, their mammogram done immediately. They don't want to wait for it. Their cervical screening, all of that, they want to get it done very swiftly, very quickly. Whereas there are certain protocols in the hospital when it comes to the MRI or other screening, modalities. We need to prepare the patient, and we also need to prioritize the patients according to the needs. So MRI is a kind of a modality which is very much nowadays in use by almost all the physicians, and they want to get their patients screened through the mammogram and through the MRI. And we get into this kind of dilemma that how to prioritize the patient and how to satisfy a patient who has got an anxiety now that I should get myself prevented from such a disease. And this really gives us an opportunity to talk to the patient and help them in understanding and reducing their anxiety levels, that why you should be anxious and why you should not be anxious at this point in time. So that part is something that we work a lot on in order to engage the patient in a very healthy dialogue and to let them understand about their selves and about the people around them, the other patients, and how we are managing the patients in terms of the priorities or their disease, activities. So this is one of the things that we usually come across, and we try to help out the patients and try to improve their patient experience by helping them with with the words and with the knowledge that what they need to understand at that point in time. So that's something, an example of our patients that we usually come across. When it comes to the the employees, um, they they have they are all healthcare workers, and they are very resilient in their nature, that they are working in a healthcare organization, and how they can empathize, and at the same time how they can help themselves by not having those stresses and burnout from their day-to-day routine. I had lots of examples where I see the nurses getting burnt out, the nurses getting stressed out, even the doctors, they are getting stressed out, the psychologists, they are getting stressed out. I'll just give you an example. For example, a psychologist meeting a patient is a session of more than 40 minutes usually. And during this session, the psychologist undergoes a lot of uh, absorption of the things that the patient is telling to that psychologist, and she or he has to the psychologist has to manage all the therapies during this time, and manage the expectation of the patient to complete this session in the more meaningful manner. But it really gives a toll on the psychologist himself or herself. So these people, they come back, and if they are not supported by a very healthy culture at the organization, they definitely feel a lot more burnt out. But at our hospital at Faki Health, we do a lot of de-stressing exercises, how to manage their work-life balances, how to manage them and manage their expectations in terms of their burnout. So for example, we run across every year the employee engagement or employee satisfaction surveys with the third parties to understand how much they are still facing these stresses or these burnouts, what we can do to help them out, how they can enjoy their routine at the workplace. So what's the fun activities that we can engage them in. So this helps them a lot to detoxify themselves, out of those routines that they're coming through. So I have seen very positive outcomes when you engage with those employees, when you engage with them on day-to-day basis, on formal and informal basis. It really helps them a lot, and they understand that now they are being encouraged, and their psychological safety is important to the leaders in the organization. And we encourage an open dialogue for them, and we ensure that employees feel that they are respected and heard at the end of the day. So when this trust factor exists within the organizations, teams really become more resilient and better equipped to navigate any changes.
I think that is such a positive thing that you're doing at your organization, is actually tackling burnout a lot more seriously than other organizations do. I mean, I come from South Africa, and so many of our pre-hospital providers actually end up leaving the country or going into different businesses, lasting 4 or 5 years on the road before they want to move to another system. Um, and you asked those providers why did they leave, and it's not to do with the job. It's actually to do with the fact that they're burnt out and they don't have time off, and they don't have their own. They don't have a life outside of work. And I think that's really tragic when that happens. And no person, we are human beings. We're supposed to live full lives with professional life. We're supposed to live with have time with our families. We're supposed to have time to socialize, do hobbies, those kind of things. If you don't have that, then there's no way you're going to perform at your work. Um, just touching on that, what are some of the, if you don't mind sharing the trade secrets, what are some of the programs that you put in place in order to encourage staff members to to do things that are outside of their work?
Interesting, very interesting question, Nathan. So it's very close to my heart, by the way, how to manage the workplace culture and manage the employee expectations at the healthcare setting. So one of the things which is very important, and it comes in the standards as well about the staff well-being. How do you manage their psychological safety, their physical safety, how you help them in having mental well-being at the at a good level. So we do run staff well-being programs. We do take care both sides, the physical health as well as the mental health, both sides into consideration, and design our program accordingly. So, for example, in the healthcare settings, we usually come across a lot of diseases, and many a times we come across the patients who are terminally ill, and many a times the staff has to experience the expiry of the patient or death of a patient on the OR table or in the ER. So it can happen anywhere. So we see them as kind of second victims who are experiencing such kind of phenomena. So we help them out by providing them the psychological support. So they are invited whenever we come across such kind of incidents, we invite the team who has attended such kind of incident to come and have proper sessions with the psychologist. And this our psychologists, they are conducting certain group therapy sessions as well, where the groups can be engaged and they can given the right kind of therapy to ensure their mental well-being. That helps a lot at the end of the day. I think we all have experienced after COVID-19 and now certain other incidents that have disrupted the whole world. We have seen that the psychological support is very, very important in all those kind of scenarios. So, uh, first of all, this staff well-being program is very much important for us. We do take care of their vaccination programs, their any kind of screening programs that they require from time to time. We do take care of that on regular basis. On the other hand, there are we derive different engagement programs. So again, I must say that the beauty of Lucky Health is that we have got different teams working on this engagement. So it's not only the responsibility of human capital management to work on these engagement programs. So we have a very beautiful team which is called engagers. So these engagers are coming from different departments. They get together. It's a team of say 10 to 12 people. They get together, they identify what should we do next, and they do their planning of events during the whole year. For example, they are just conducting very recently. They are going to conduct an ice cream social program. So there will be an ice cream vendor inside the hospital. It will be going through all the wards and the units to offer the ice creams to our staff, even the patients, and whosoever is there. So the people can enjoy the ice cream during this summer. So then they will be having the movie nights, which regularly happen at the hospital. The staff are invited with their families to come along with their kids, enjoy the popcorn, enjoy the movie there in the hospital itself. Then they also introduced the indoor games. So enjoying the games within our pavilion. We have a nice area where we can get together. There are different kind of board games that we have, and there is a kind of a competition that the people can engage in. They can register and they can play there. So these activities come across during the whole plan of the year. On top of that, we also do an annual kind of celebration. Usually we call it uh, a happiness festival or a gala where we all get together and we celebrate the diversity in the organization that we have almost more than 53 nationalities here in the organization. So we all get together. We encourage everyone to, clad in their own regional dress. They can come there. They can have their regional foods displayed in their, booth or their, desks. And then the people enjoy a lot. There are performances, regional performances that they can do. So such things really matter for them, and they enjoy that day like anything. So they enjoy fully that whole day. Recently, we also introduced another activity, which is Fucky Health Got Talent. So we introduced that people, if you want to show your talent, please come up. We are happy to see you on the stage, and you can tell us that what you are good at. So we started last year. It was very interesting again to see the people coming and showing their talents. Somebody was doing the poetry, someone was doing the singing, the dancing, there were a lot of enjoyable things were there. So these are just a couple of examples that I have shared, but I can, tell you a lot more because this is very close to my heart.
I think that is just such a fantastic thing to do in an organization because we often will see our colleagues as just colleagues and we don't actually um, socialize with them outside of the work. And then also just, I mean, I was just smiling at the ice creams that you hand out, and I thought it's actually more the thought that counts. Okay, yes, you get a little ice cream, but as an organization, what are you telling your staff members? You're saying to them, I care about your well-being. This is a small token. I mean, you can go probably buy that ice cream for, 2 or 3 dirhams down the street or whatever the case is, but you're providing it to them and you are giving them a sense that as employees that they are recognized and that you're trying to improve their lives, which I think is just, yeah, and I think that's really amazing. But in terms of, workplace culture, probably some of these things work well, and people will engage. I love the idea of a talent show. Um, you do need to build in a professional workplace culture that is outside of just trying to maybe generate happiness. So just so that I can understand, because I've got this very abstract idea of what workplace culture is, but just to you, how do you define workplace culture?
Very, very important question, I would say, Nathan. How to understand and how to define a culture in one organization. To me, it is based on two main things. One, I always say that what are the values of that organization? That is the foundation of your culture. You build up the whole building on that foundation of your values, and you keep on putting the building blocks on top of that. These activities, these all engagement things, these your care for the employees, your care for their well-being, these are the building blocks of that whole building. The second thing, which is really vital for any organizational culture, is your leadership team. How the leaders are behaving at the workplace, how they lead by example, and how they respect those values inside the organization, how they respect each other, how the interpersonal relationships are there, how they value the efforts of the employees. Is there any rewards and recognition framework? Or do they really care about only the numbers or the business performance? What is in their mind that comes out in front of the whole staff? That matters the most. So your leadership, um, gives this importance to the strong culture in the organization and make the people feel better while working at that workplace. So these two are the most important foundational elements, I would say, for workplace culture.
I think that's a nice way of putting it. Um, And I like that idea of building from a foundation. So you decide for your organization, you want to have these certain building blocks, and then you build on from there. I think that's extremely important because a lot of the times as an organization, we can lose sight of what our goals are, and we just end up fixing problems as we go along without actually going back, planning, understanding what's going wrong, and especially with our culture, and then moving forward. So, uh, how do you build a good workplace culture or a healthy workplace culture within the organization?
Um, the healthcare leaders, they operate in an environment where expectations continue to grow. We are accountable to regulators, accreditation bodies, investors, patients, employees, and the community as well. All these elements are very important for the leaders in the organization, in healthcare organization. The culture begins with the clarity of purpose. When employees understand that why we exist and how their work contributes to patient care, they remain connected to the organization, regardless of the external pressures you know. So transparency is one of the important factors that can help you to trust, to build that trust in the organization. People don't expect leaders to have every answer, by the way, but they do expect honesty. They do expect the consistency and the authenticity, the genuineness. So, as leaders, we all have the responsibility to create that psychological safety, encouraging open dialogues, and ensure that every employee feels respected and heard. When trust exists within the organization teams, the teams become more resilient and better equipped to help out and go through the change process and the business performances.
I think that's so important. How do you go about motivating clinical staff and administrative staff? Is there approach that you have that is separate for both of them, or does the single spanner work for all nuts?
Very interesting. Employees and clinicians, they all want to feel valued, respected, and connected to a meaningful purpose. Uh, they want the leaders who listen, who can communicate again openly and recognize their achievements and invest in their professional growth. Interestingly, I'll just give you a very small example. So, usually in healthcare organizations, I have seen the four divisions of the employees. So, one is your physicians, the second one is your allied healthcare professionals, your technicians and your physiotherapists, the pharmacist, etc. And the third one are your nurses, who are the major chunk of your headcount, and then the administration staff. So these are the four categories that we usually have in the healthcare organizations. And there was a very nice thing that happened very recently that we were celebrating the International Nursing Day. Usually the nurses are very active, their departments are very much organized. They go, they celebrate their achievements, their successes. They try to be on top of their competencies. So they're very well organized. Whereas when it comes to allied healthcare, they are scattered into different departments and they are reporting to different heads, and there is no interconnectedness between them. So I got this feedback from my anesthesia team that, you know, You guys are celebrating always this Nurses' Day, but what about the allied healthcare professionals? You're not celebrating their day. So I said, yeah, that's a very valid observation. So why not to celebrate? So we just last week we did that. We got together all the allied healthcare professionals and we celebrated their day with them. We recognized them. We rewarded them for their efforts. It was the first time, even in my experience, that we were celebrating together all these allied healthcare professionals. So they really felt, elated, and they felt that they have been given an importance in the organization, and their day was celebrated. So yes, there are different feelings with different group of people. They have different emotions. They are being differently dealt at the organization. But we should not forget that they all are contributing towards one goal, which is giving the best patient experience at the end of the day. And either they are on the front of the desk or behind the desk. They are there. They are there to care for your patients. So we need to give them kind of importance equally for each group of those staff so that they feel that they are being understood and they are engaged and they should believe that what is the organization's mission towards the patient. So all should get together and work towards the organization's mission.
That's such a nice way of doing it because I think so many times people that are in the organization don't feel recognized. They just feel like they go in, do their job, and leave, and there's no real recognition from managers. And often when you hear complaints about managers, they'll say something like, that they just don't recognize the work that I do. And then from the managers, obviously will say, well, you're just doing the job that we're kind of paying you to do. So that recognition that is outside of, just everyday recognition, I think is really important. So if you look into the kind of the crystal ball and you look into your crystal ball there, and you look at the future of healthcare, how do you obviously from the private sector, how do you balance profitability with quality care? And how are you building systems that are taking both into account?
I believe the future of healthcare depends on our ability to balance all the three. Financial sustainability is essential because it enables organizations to invest in technology, innovation, workforce development, and better patient services. Operational excellence ensures that resources are being used efficiently and the patients receive timely, high quality care, compassionate care. Uh, and then the patient experience remains the foundation of everything we do because healthcare is ultimately about people. These priorities should never compete with one another. Instead, they should reinforce one another. As healthcare continues to evolve uh, through digital transformation, AI, and changing patient expectations to the next level, organizations will need leaders who can integrate technology with humanity, strategy with empathy, and operational excellence with strong organizational culture. At the end, the healthcare organization that invest equally in their people, in their patients, and performance will be the best ones positioned to deliver sustainable success and lasting impact.
Yeah, no, I think that's so right because you can look at some organizations and you can just see, or maybe even healthcare systems, you can look at those healthcare systems and say, we're not optimizing, the financial aspects, performance, operations, all of those things. And it's so easy to let one of those slip, and then the others end up falling because of it. Dr. Fan, we've got a closing tradition on our podcast where we ask the guest a question that they haven't seen before. Your question, and we've had it's been quite a positive episode so far. maybe this is going down into a little bit of a darker area of what we're speaking about. But your question is, does healthcare in general still have a bullying problem that no one wants to admit? So is there a bullying problem in healthcare within our structures?
Mm, Nathan, this was the culture before. This was something that was there in the healthcare organizations um, a decade or 2 decades before, I would say. Since I have been working in this field of healthcare for the last almost 20 plus years, I have seen this awareness becoming more and more towards bullying within the healthcare organizations. There is a big culture change that has come in with the zero tolerance on bullying and respect for everyone. Uh, and I can see in most of the organizations now where I have worked, their values include respect for everyone. And that came up from this point of bullying that used to be there or that was, in their cultures before. But now the people are trained, people have been made aware, they have been educated about the workplace violence, and any harassments, any bullying at the workplace. Our standards are very clear, very firm, and they have all those red lines that you cannot cross. You cannot bully anyone at the workplace, and you have to be part of the team and not the problem in the team. Your participation has to be equally seen in the team. You are be a leader. You may be a leader. You may be a head of the department. You may be a manager, but your respect towards other is very vital now for the workplace cultures. And there is zero tolerance now for any such cases where you show that you do not have the right ethics or you are intimidating to others. So that is very, very important now to build up that trust in the workplace. And that's something which Fucking Oak does not compromise on. We have got zero tolerance for any kind of bullying at the workplace.
Think that is a really great note to end off, because I think even in my career, I've seen how healthcare is changing. It used to be extremely hierarchical, and there seems to be a lot that was happened. Well, a lot that happened in my career that I would look back and say maybe that wasn't great. But it's been a really great conversation. Thank you very much for joining the podcast. It's been great having you on and hearing your thoughts on these things.
Likewise, it was really a pleasure talking to you and touching upon those important areas of healthcare, organization when it comes to the culture and the patient-centered approach. I'm really pleased to have this conversation, Ethan. Thank you very much for inviting me here.
Thank you so much. It's been great.